That's wonderful to see that. And Inspiring Minds and at the University of Strathclyde, who's going to be telling us about innovation in children's rights and ways in which we can learn about how we can take what we've been talking about over the last couple of days, how we can try to infuse policy, practice, and so on through examples of the work of Professor Davidson in Strathclyde. And to think what we're going to be doing this morning is to be very much thinking about how what we've been talking about yesterday collectively, and it was a wonderful meeting yesterday where we had a lot of very passionate discussion around all manner of issues and factors. So we discussed how there are so many young people, children with neurological disabilities, neurodisabilities, neurodivergence within criminal justice systems worldwide. The reasons why they're there is often because there's some system failures, effectively, whereby schools, healthcare systems, social care systems have somehow not been able to find a solution to enable people to stay in society, and behaviours that may be due to a neurodisability may get criminalised. And so it's the awful the kind of the last stop for these young people, one way or another, at a relatively young age. So, what are we going to do about that? How can we try to influence things in a way that might try to change the trajectory of young people's lives, where there are neurodisabilities or where there are not neurodisabilities? But the thing is that what was also emerging yesterday is the way in which the conditions that young people get put into will lead to social, emotional difficulties and so on, because of the impacts of their forms of exclusion from society. I like Stan's phrase yesterday about forced inclusion. Once you've been pushed out, you've been pushed into being utilised by others, by predatory crime groups and so on and so forth, which means that there's vulnerabilities to other things happening in one's life. And so it goes, more and more embedded within criminal activities, which are alternatives, but they're not alternatives that are choices that people want to make. They're forced choices. So yesterday we were learning about also about rights of the child, the UNCRC, the various articles within the UNCRC, where it's a case of trying to take some of those articles and try to embed them in ways in which policy can be shaped to enable children to get the appropriate support. We had that discussion about what's assessment for, because doesn't that just label? It could do, especially from a forensic perspective. We want to know how much of a risk this person is, which is awful, because it's not about risk, it's about support. So we need to find ways for identifying the needs that children have so that we can provide the right kind of scaffolding of support around them with a whole system approach that allows children to thrive. So this morning we're going to hear from Professor Davidson in a moment, and then we're going to have a bit of a conversation about, and we can have a chat with her as well, and then we'll have a break. And I think Brian, where is Brian? Okay. Brian, thank you for volunteering yourself to help us to think about how we can create something from this meeting to take forward with us. So we'll come back to that in a bit. Okay, well, thank you very much. I'll just hand over to Professor Davidson. And how do I do that? It's easy, just Mariana. Oh, thank you.
Hello, Jennifer, can you hear us? Can you perhaps?
I can hear you. Hi, Mariana, how are you?
Hello, good.
Good, hello to everyone.
Perfect.
Yes, we're ready.
Great. Great, so I'm delighted to be invited to speak with you. And I have to tell you, despite the many years now of COVID, I actually can't believe this is the first time I'm giving a presentation to a crowd of people I can't see who are sitting in a room. So I'm imagining I'm imagining smiling faces, and I know some of you are familiar faces to me. So hello to those of you that that I have known before. Oh, look, there's a camera. I get to see you. Hello, everyone. Thank you for being friendly and smiling in the morning. And I know you'll have had such an interesting and I think a very stimulating few days of considering such an important topic, and one that's not considered often enough. And so I feel really honored to be invited to be joining you. And I really liked the fact that I was introduced with the idea that there would be a chat, because I would like to share with you that I'm here to speak more in an informal way, to talk and reflect with you about some of my learning. And I so wish I was there in person, because actually this should be a two-person, conversation, because what I bring is simply questions and maybe some experiences, but nothing that's I think anything that will be different from what other people's experiences will be. So please take this in the spirit of a humble offering of some reflections and perhaps a framework that's useful to sort of hook your different conversations on and your different approaches on. So there are three sort of frameworks that I'd like to share with you. Two are not visual, and one is a visual that I'll share my screen just at that point. But a bit of background first, and what I would normally do if this was just a webinar is in the chat function that I would give you the link to the Justice for Children, Justice for All project. And so I might just let you know that if you would find that I don't even have the link to myself right now to be able to share it with you. But when I share my screen, I'll add that to my PowerPoint slide so you can see the thing I'm talking about. I'm the lead for the working group on the Justice for Children, Justice for All SDG 16 effort. And we are seeing the SDGs as it's not new anymore, I suppose, but as an additional hook, if you will, or a way in which we can frame our messages to be heard differently. And so I think it's on that basis that I've been invited, that this idea about thinking differently and framing things differently. And so the first thing I wanted to think about with you is framing. The resources I would refer us to, and I can follow up with perhaps with Mariana afterwards with some links that if you're interested. But the Frameworks Institute in the United States have worked internationally to try and help us think about how we frame our messages so that they are most palatable and engage people and bring them with us. And so, of course, the whole agenda we have here is to be thinking about how we bring people with us on understanding what the issue is and ultimately on securing their agreement. So if we're framing our arguments and we're framing our agenda and our issues, because our agenda is to get greater agreement on a particular issue. So with that, the concept of agreement in mind, and I'll come back to that with that visual at the end, but there are lots of different mechanisms that you will know probably far better than I will, but I would just like to name that my experience of the work has been the words that we're using clearly are so important. The images that we use are so important. We know, the examples of where it's gone really wrong, where we see a picture of a child, and I think it's been casually, if this isn't an offensive term, referred to as poverty porn, where we're using sympathy to try and generate funds for because ultimately children do need additional funding put towards them, but we weigh up these difficulties, don't we, around what is the ethical way in which we represent children. So these words, these images are really critical for us to be thinking about in the context of of children's rights and what will ensure that they retain dignity. The other element, in addition to sort of words and images I want to bring in, is this idea about simplicity and clarity. And that's really, really difficult when we're talking about systems change, because those of us that are immersed in these things that we're trying to change, we know so much about the nuances and the complexity that it's really hard sometimes. I find it really hard to come up with a simple language to describe what the problem is. But when it's done, when someone's done that and they do it well, it's a very compelling message. So I have my colleagues in my office who edit my work joke with me about how they always remove commas. I've got these sentences that are far too long. So I'm not the poster child for simplicity by any means. However, I do think that when we see something that's really simple and really clear, we recognize the power of that to capture people's imaginations. And I think in the simplicity, it also can capture people's agency, their sense of I can do something about this because this isn't too overwhelmingly complex. So words, simplicity. I think the other piece that that we are increasingly holding on to now is this idea of hope. So how in our description of the issues are we thinking about hope? How are we conveying hope? How are we giving solutions? How are we affirming that people just want to do right? No one's trying to go out and harm or create systems that harm. So if we're hopeful about our messages, it's more likely that they will be sustainable and stay with people. And that, I think, is sometimes a bit of a tension for us because we know too much about these harms for children and young people sometimes. And I know there are times when I'm incredibly angry about the choices that are made in relation to a whole number of things. So to be hopeful in our passion is really important because I think sometimes our passion and our descriptions about what we are concerned about can actually turn off people's listening and hearing. Again, I'm sure experiences that you've had. And then the most recent thing that I actually think is one of the most hopeful things in my career that I've seen in the developing, certainly in my experience in Scotland in the last several, maybe 8 years or so, but globally, is the increasing voice of people with the lived experience of the issues. And so where they're speaking about what the experience has been, my witnessing of that is that policymakers in particular, when we're thinking about shifting policymakers hear that differently. They hear experience differently than fact. And not only is it right to make sure that people with experience of the systems we are leading have a voice into ensure that we're shaping them based on their experience. It's also, so there's a whole number of rights, human rights elements to that I don't want to put aside, but from a excuse me, from a framing perspective, voice is a different kind of voice, and it's a really important one for us to place high value on. However, I think in the context of what you were talking about in the last few days, that's even more complex because perhaps those who are experiencing the discrimination may not necessarily be the strongest advocates for what their experiences have been. So I think it becomes more difficult when we are the curators of the messages of lived experience, because then we become the ones, we're always curators to some extent if we're in power, but or if we're shaping an environment in which people with lived experience are sharing their views. But but I do want to make sure that we're keeping in mind the idea of voice in the context of framing. So I've named these 4 elements of words, voice, simplicity, and hope. And now I'd like to just think through with us briefly about, and like, I don't know if it's possible to take questions or if you'd like me to stop. So let me just say that I would definitely stop right now if I was in person and say, are you with me? Is this resonating? Thank you, person in the front row. Yes. That's great.
Yes.
Okay, perfect. So the next, do you want to stop for a minute or would you like me to continue?
Yeah, there is a question for Jennifer at the moment. No, I think you can proceed, Jennifer.
Okay, thanks. Okay, thank you. Great. So the next thing I wanted to just reflect, and I think was that Cedric's voice I just heard.
Yes.
Yes, Cedric, you will know this conversation we've had then. There are these very different, there's a real tension that I see working both with children's advocates and policymakers that have an impact on children. And the tension that I see is that how advocates speak about the issues with passion, with sometimes real contempt for those in power who are not making the right decisions, are very easily are very easily framing the issues in a way that policymakers are not hearing, and that policymakers are not necessarily looking to discriminate against children. However, we do know that policymakers are faced with a real variety of a range of policy decisions, which will be difficult to make in any situation. And they are trying to weigh up the best policy decision related to our issues, as well as a whole broad range of other issues. So how we shape our messages to policymakers in recognition of this range of tensions that they are sometimes having to make where they're conflicting challenges that they're making decisions about, where the policies are having to make decisions that are directly in competition with each other around the cabinet table in government. These become very different kinds of conversations that we need to have, and how we turn that, how we draw on hope, how we draw on the simplicity, but how we also are helping to enable policymakers to be thinking about the impact of change that they can make, and the unintended consequences of policies that they're undertaking that they may not have thought about. All of these are very different kinds of conversations. And I think I often reflect this with my colleagues who are academics. Sometimes I know this will not be the case for the people in the room, so forgive me for being incredibly broad brush in my description, but sometimes I think we start from what we think is important, but when it comes to speaking to policymakers, we need to be starting with what they think is important. What is their challenge? What is important to them? What is their mandate? And how can we hear enough? How do we listen to what the position is they're in to then be able to reflect with them with the information that we have? So we're starting from them, and then we're bringing in all of the range of knowledge that we have in sort of in bite-sized pieces, but in ways that can be compelling. So I think that there's real tensions between how research is developed and written about, how advocates think and talk about this research and undertake the research, and then how policymakers may be using that research. And those three are very different audiences, and they're very different words. It goes back to the framing, different words. There may be different voices we bring in. And clarity and simplicity is important, but we can't stop there. We need to bring in the nuance, and ultimately policymakers need to feel that there's something they can do about this, that we frame it in a way that we can make change happen. I'm just going to clear my throat, excuse me. Thank you, sorry about that. So the last image I'd like to bring, the last thought that I'd like to bring, no, I'm gonna have to clear my throat.
Can I ask a question, Jennifer? Can you hear me?
I can just hear you, yep.
We're getting them. Okay, you can hear me better now.
Perfect, yes.
So perhaps could you give us some examples of how you tackle that policy question? In my head, I'm just thinking it's all about the money. But you may say, well, actually, policymakers are not all of that. But what have you found as a successful way of framing this with policymakers that perhaps you know about or have come into contact with?
Yeah, I think maybe there's probably, so at a national level and an international level. So at the moment, our strategy with justice, it's a great question. At the moment, our strategy with our Justice for Children work, which is looking to try and ensure justice for children is understood to be part of the Justice for All agenda. So there's a growing movement for justice reform that is people-centered. And we are reminding those who are leading in justice reforms that they must remember that children are a part of justice reform, and that there are systems of justice that are impacting on children that that adult justice reformers may not be taking into account. So we remind them of the ways in which their decisions are affecting children. I don't want to present this as here's a great example of how we've spoken to policymakers, but I'm reflecting it as a strategy, and we can watch and see as to whether this works. We are closely aligned with multilateral organizations, so agencies that like the OECD or UN agencies like the UNODC, and the Pathfinders for Peace, Just and Inclusive Societies, which is the Pathfinders for Peace would be most important here, which is the membership of national governments and NGOs who are working together around SDG 16. So these multilateral agencies already have good relationships with member states. They tread very carefully. It can sometimes feel like compromise in terms of how forcefully or not they may be making points. These are the multilateral organizations I'm proposing, like the OECD. They are, however, they have the ear of governments, and the publications that they produce are respected by governments. So if we're able to influence those multilateral organizations by offering good practice examples, by offering the analysis of the change that needs to happen, by offering the evidence that will help to make them do a better job of their work to inform national governments. These are really, in my view, very critical stakeholders in our agenda for children, whatever the agenda is in relation to children, because they have influence over national governments, and they are safe people for national governments to speak with. My experience from Scotland, my background is that I was the founding director of CELSIS, which is the Centre for Children's Care and Protection in Scotland, and was funded by Scottish government. So even just the fact we were funded directly by the government to deliver on policy meant that there were some real risks of being perceived to be colluding or too close to government in terms of policy. So I think if we're engaging with policymakers, we have to be quite careful to be, we have to be willing to be perceived to be too close to government. Government also perceived CELSIS to be too close to the sector, to the sector of social work. So it was actually we always walked a very fine line, and I think probably satisfied no one. But it meant we had a very we intentionally, proactively developed the relationships with civil servants. The politicians, yes, but the civil servants were the most influential people in the policy agenda in Scotland, I would say. They then were able to inform politicians about some of the issues that otherwise we wouldn't have been able to inform. And because civil servants were informing the politicians, it meant that civil servants were obviously their loyalty was to deliver for their ministers, and so they were safe conduits of information, not always accurate conduits. And actually, my experience in Scotland is where voice comes in, because the voice of lived experience has been tremendously loud and powerful and incredibly inspiring for change. And it's transformed the agreement across Scotland and the efforts across Scotland, I would say at all levels of the system, working towards children on the basis of both, certainly not just my efforts at CELSIS, but a growing understanding at a government level of the importance of focusing on children who are in care, and ensuring they have a better response from communities and from government to be supported to compensate for the problems that they've had, and to have more of a prevention focus on children and families before children come into care. So I don't know if that answers your question fully, but I do feel that there's something about being willing to engage in relationships with the civil servants. And I start from the position of no one is trying to do a bad job. I guess maybe the last point to say about this would be, I absolutely agree that the budgets are huge drivers. And so actually part of our strategy at the moment is to undertake a program of work around what we're calling smarter financing as a strategic lever for change, to be developing an investment case or a model for how countries can develop investment cases related to prevention in the context of justice for children. And so this is very early days for us, but the wider Justice for All agenda has focused on smarter financing so that we can, as an area, as a lever for change, with a view to needing to be bringing our ministers of finance on board before we can really secure sustainable change.
Thank you.
May I share one image? Sorry.
Yeah. Oh, hi. I'm Hugh Williams, I'm one of the conveners of the meeting, and just wanted to ask a follow-up question to Stan's question. You mentioned that it's not just about budgets, but smarter financing is incredibly important. And I guess the point is that in governments, there's budgets for each department, education, health, criminal justice. And smarter finance could mean being better at that preventative piece to try to reduce the future financial burden, but also improve GDP through enabling more people to participate in that society. Is that the kind of thinking that smarter finance is about?
Yeah, spot on, Hugh. We think about it in 4 ways. So we're thinking this intervention, prevention, it is impacting on children, in the short term and children in the long term. It's impacting on families and society in the short term and in the long term. And we're thinking about that in relation to both what are the cost savings, because perhaps a child is able to thrive and the cost to public services becomes less because we've managed to support them in the community in the way that they need. But also longer term, they are then contributing to wider society, and from a perspective of GDP, are better enabled to contribute to the tax dollar, if you will. So we're thinking about short and long term, both for the child and the society. I can share with you a model for that. We have on the Inspiring Children's Futures website, we have a learning report that has a model of thinking through these different components of, and the risk, I think, in this financing, Hugh, you'll know this well, I think probably, is that if we only speak about the costs, actually sometimes we lose the argument. It might be cheaper to put children in detention than to invest in prevention. So we need to make sure we're talking about costs and benefits, and we have to be ensuring that the benefits are well considered when we're costing those out.
Absolutely, and thank you very much for that comment. And if you could share that, that would be amazing, because it's about so I'm looking around the room and I'm thinking one of the key issues is working in high, mid and low income countries. How can you get across the benefits, and how can you make those long range savings in societies where one of the biggest issues that we've been talking about as a condition that's associated with economic burden long term is traumatic brain injury, which has a massive effect in the global south, and the costs in terms of criminal justice are huge across the board. But it's an indication of the lack of spending in other places, which then puts the spending somewhere else we don't want it to be. So I think it'd be really interesting to see how we can build up the capacity around UN SDG 16 around that peace and security and financial benefits, but also, you very rightly say, there's also risk with that cost model. So how do this one get that model across? So thank you very much for your response there.
Great, and that's a really important context you're sharing. I think it takes it takes ministers who are willing to take risks, because the shifting of that financial investment from the high cost to perhaps detention rather than prevention in the community long term, in the context of those you're speaking about and their circumstances, it may actually be much of holding a risk in the community at a higher level, which can be risky for ministers in terms of that policy. So I think there's also a question about how we help ministers to hold their nerve in changing that direction and being very vocal about what the benefits of that change has been in order to keep that sustained momentum. Perhaps, Hugh, the other piece that would be useful to you in that question is that I can share with you is a report we've done for the OECD on developing a whole of government approach to sustaining child well-being. It's that idea of how can we learn from climate justice and mainstreaming of climate agendas and mainstreaming of gender agendas, and how do we learn how governments have worked with those, how governments work across to ensure that all of their policy areas are delivering on that agenda. But instead, we're talking about children's agenda, but for you, it may be a different way of framing it. So how are we thinking about informing that a whole of government approach to the agenda you're talking about? And there are mechanisms that can help that happen, driven by government, but also mechanisms that can be driven by communities and wider society that are important for their long-term sustainability, I think. I've taken a lot of time, so I think I'm just going to share my screen. Is that visible there?
That's wonderful, if you could. And I'm just asking if anybody's got more questions for you as well.
Okay, great.
Share it, please.
I'll share the screen and then let me just make sure I've got that going here. So I'd like to share one. Is that coming up for you?
Yeah.
Okay. I'm not even going to fix the display because I'll be distracted, and I want to make sure I can stay focused. This is called the Stacey matrix. You can Google it. There are millions of these images if you're not familiar. And what today we've been talking about so far has been both agreement. We're trying to think, how do we get wide understanding and agreement of the issues? And then we've also been talking about the evidence that helps us to be clear about what we can do about it, which I would call, or Stacey would call, certainty. We're certain about what the right thing to do would be. So this is, I'm showing you something with two axes. One is agreement on this left-hand side, and then we've got certainty along the bottom. We've got no agreement at the top and a high agreement at the bottom. We've got absolute clarity in the left-hand side, and then we've got no clarity or no certainty about what to do on the far end on the right. And in this axis, it's helping us think about complexity and our actions that we're taking depending on how complicated or complex the agendas are. And I love this matrix because it helps, for me, it helps to steer my thinking about what the actions are that I may take next, or a movement might take next. And I want to give you two examples just so you can sort of place this, and I will leave it to you to place the agenda that you're speaking about here onto this matrix. But the simple in the bottom corner on the left is something where we have high agreement, we all want this, and there's clear evidence that this is something that's how to get there. So the example that I use is in hospitals, we don't want to get sick. If we're already sick, we don't want to get any other additional illness through germs in the hospital. That's pretty strongly agreed. No one would probably disagree with us. No one would go in looking for it to be sick, to become more sick. So we've got high agreement that this is something good to not become more sick in the hospital. We also know that hand washing is a clear evidence-based process that if people wash their hands, they're less likely to transmit germs in the hospital. And so there's a very clear, simple, it's not easy, but it's at least fairly straightforward that we're trying to increase hand washing in hospitals in the right kind of way. World poverty, on the other hand, do we agree? Do we even have agreement that in this room we would have agreement, I'm sure, that, but across the board and across society, do we have agreement that poverty is something that is changeable? Is it something that should be ended? Is it, I spent some time in the United States, especially in Texas, where people, would argue that it's their own fault. They haven't done what they needed to do. They should pull themselves up by their own bootstraps. There's quite a range of views on poverty. And also how we reduce poverty, the evidence of that is harder because it's in this space of multiple levels. So this is when we're dealing with something simple, it gives us some tools where we have tools to be able to implement through improvement cycles or very clear practices. When we're talking about complex issues like poverty, or I would say like the issues of justice, these are on the cusp of chaos, if not just into the complex zone. And so our work is in trying to create a movement is in any of the advocacy work we're doing is to try and move things from the chaos complex edge into being complex or perhaps even complicated. And so if we're trying to move down this from the green or teal into the red in that direction, the way we're doing that is by increasing agreement and increasing certainty. So we're framing the argument so that we have more people agreeing, and we are seeking out the evidence that gives us clarity about what can be done. And in that effort, we are getting closer to a place of being able to make change because people aren't, we and others are not overwhelmed by the complexity and paralyzed by it. So I just wanted to share this with you because it helps us come back to some simple elements of agreement and certainty or evidence that that may be useful in the conversations that you're having in framing the actions that you see being taken in your area. I've given you a lot in one slide, and this slide we could spend a day talking about this. So I'm sorry if it's a bit if it's not simple and clear in my presentation in the 5 minutes.
It's a very helpful slide. This is Catherine. Hi, the one in the front row.
The one that cheers in the front. Hi, Catherine.
And I find it really, really visually helpful.
Great.
Oh, hi. So anybody got some questions for Jennifer? Or thoughts? Oh, at the back. Yeah. Oh, hang on.
Hello, hi, thank you for the presentation. I had a simple, not so simple answer probably, but question. Because I was wondering when you talk about poverty and the reason that poverty comes up in different contexts is sometimes very complex, and sometimes we have seen, like I come from India, and what we have seen with different poverty programs that the government has put up, some successful, some of course not successful with all the bureaucracy and everything included. But what happens is some people get very used to that situation. They're more comfortable living in that circumstance, and it becomes really difficult to convince them to change something they have been generationally living into. And it becomes very difficult to penetrate those places where, like, for example, one of the biggest slums is one of the towns there, and multiple times the government has tried to rehabilitate them, give them money and other resources, but the extent of it is so large, the network is so large that they keep relocating and recreating the slums in different places. So I was wondering, with your understanding, what would be your suggestion for to maybe change such a system, or to bring the children in such system out of that cycle and give them hope for a better life? Maybe, I don't know if my question makes sense, but
That's a great question. So I have to disappoint you. I will have no answer, but I will have more questions. So the questions that this Stacey matrix might raise for me is, there's not agreement on the change, it sounds to me. I think if there's agreement about what we might like to see these people who are living in poverty to change. I'd be interested in understanding what their view is about what's drawing them back to what they have always done. And there's something that's frustrating the effort. And so I wonder what the voice of people with lived experience of that might say. And it strikes me that perhaps we have we're perhaps not seeing something of the value that seems to be drawing people back into that. So I'd be really curious about what's happening in that space, and be straining to listen to something perhaps that in the efforts to make change that we might have missed. But as you say, it's very complex. And so how do we get greater agreement on what the outcome is? Is it going to be through listening, and listening to perhaps differently or to different voices? And then actually what has to happen might be the problem. And there may be more to be understood about what the change needs to be for it to be the type of improvement that everyone agrees is what's needed. So I suppose it strikes me in the complex space. If we're not moving where we want to get to, we may be missing something, and we need to be listening more carefully to different voices. I guess that's my simple response to that. And I'd be interested to ask you if all the voices you feel have been heard in that situation, and if there are alternatives to the solutions that are being offered that may be not yet understood well enough, but might need to be pursued.
Well, thank you for that. And I've got a question over here from James.
It was just really to pick up on what Pele said, that I've sort of spent a bit of time living in Southeast Asia and places like that, and I was always overwhelmed by the difference in culture. So people will spend more time making beautiful sculptures out of beer cans and rubbish and things that we would chuck away as Westerners. And I wonder a bit about the clash of culture that we are, we're a society and an economy driven by wealth, and sometimes not necessarily in a good way. Whereas the cultures we're talking about very often have a different approach, almost like I won't say reject, I won't say being rejecting of wealth, but but it's less important compared to, say, quality of life, spiritual well-being, this kind of thing. And I think that the complexity comes in trying to shift the, I suppose Marx would call it ideological values, the beliefs of that culture that preserve the way things are. And maybe that's what Pele's also referring to when she says these people are quite, used to the situation and are accepting of it, and therefore will struggle with the idea of change. It was more of a comment than a question, I suppose, but there we go.
Really interesting, James.
Well, is there
Yeah.
a question in that, James? But how do we? One last question. I think the question in there, James, might be something to do with. Sorry, Jennifer, I know James rather well.
Please, no, go. Please go ahead. This is a chat amongst all of you, please.
Yeah, well, I think one of the things is how do you, because I was thinking, how do you work across UN SDGs? So 16, peace, justice, anti-corruption, linking to UN SDG 3 and 4 to do with health, education, and so on. All these are intersectional, and they have one way or another. There's an underlying aspiration towards change, but as James is reminding us, and Pilar is reminding us, that people may not want to change. It's another form of imposition. But at the same time, there's needs that people have, mass transparency needs, etc. So there's how does one situate change, what's called change, social change, in multicultural, multi-socioeconomic, multi-value systems. I mean, and yeah, I guess that's the question I have. How does one situate that?
I'll respond to that great question with a reflection. So as a Canadian, I worked for many years with young people from Indigenous communities in Vancouver. And I was continually impacted by the assumptions that I brought that were assumptions of what was the right thing that people needed. And so even though that wasn't cross-cultural across country, it was very cross-cultural in relation to assumptions that I brought as a white middle-class woman into my work in my 20s. I think so for me, the same question that I hold from that moment is similar to answering your question, Hugh, which is who says what the right thing is we're trying to aim for? And if those, even this slide offers sort of something quite simple, which is that we're all trying to aim to get to that bottom corner of simple, doesn't it? But actually, this is the real life is 4 dimensions. It's not just this one dimension. The SDGs are this multilateral group of individuals all trying to find a space for their agenda to be heard. I think it simply gives us a framing of the issues. But I guess I want to come back, Hugh, to that question with a reflection, which is if we're all just talking to each other at that multilateral level, but nothing is really penetrating through layers to national governments, to local areas, to real people, then the SDGs will not have much meaning at all. So I'm quite conscious that we need to be asking ourselves questions about what do we assume we're looking for agreement on in relation to Stacey Matrix, because maybe those assumptions aren't right, and maybe we need to be listening more. And also, how much time do we want to spend in the advocacy space amongst people that perhaps we're all agreeing, but it still has no penetration through to other levels of government and to local and to real people. So these are tensions that we hold in our efforts, and I think we can only remain effective in our work if we're holding these questions with us always, without assuming that we've concluded, that we've discovered what the right answer is, and that we need to be listening to be ensuring that we're even asking the right questions, if you will.
That's a great response. Thank you very much. I noticed James's hand is going up again, and both hands. Before I say anything else, anybody else want to say something as well as James? I'm looking across the room towards Cedric. Anybody? But before I hand this over to James, I think that was a great point about how can we identify some of the, we may assume there may be cultural barriers to change, but they may not be as well. That's the thing. So it's there's human rights, there's cultural rights, and how do we navigate those rights, and how do we make sure that what we try to do is as enabling as possible within the context of the cultures, the languages of people and their experiences. So we need to understand where people are coming from. Was my reflection. We're going to quote Marx again, James.
No, I won't go on to my Marxist ideologies again. But I mean, it strikes me that, you know, people die in these countries from completely treatable, manageable diseases like diabetes causing kidney failure, for example, and they die very young. You know, and so it occurs to me that poverty isn't really about the wealth, but actually about the kind of healthcare that we could support, or the education. And again, it probably has to be done incredibly sensitively, because lots of different cultures have different views on what healthcare should be and what education should be. But it almost seems that would be a better approach than trying to generate a wealth mechanism to get rid of poverty in that sense.
But James, what you've just done, I've taken the slide down, but what you've just done is you've created more clarity, haven't you? Because you're not saying let's eradicate poverty, you're saying let's end premature death as a result of lack of appropriate healthcare access, for example. I'm making that up, but I'm trying to reframe what you've said. You've created something much tighter, and it makes it more achievable. And actually, just in what you described, I feel more hopeful. So I think you've named something, you've described something really helpful in sharpening what's the issue we're trying to solve here, and you've made it tighter so it's more achievable.
That's brilliant. Oh, Catherine.
Thank you very much. Hi again, Jennifer. I'm Catherine. I'm the other Canadian, so really glad to have you here in the room. And I'm also so appreciative of your comments about working in Vancouver and working with Indigenous peoples, because that's, as a fellow Canadian, a theme that runs through a lot of the work that I do as well. So I'm a clinician and an academic, and one of the things that hasn't been raised here, but as I'm putting together notes for consideration of informing policy and moving forward, is what the role of the World Health Organization might be in this, and also looking to the WHO ICF model, which, if people are not familiar, that is the International Classification of Functioning and Disability. And I can't share my screen, but Jennifer, I don't know if you're in a position to just find on Google ICF, WHO ICF. So what this is at the top of the model, it identifies a health condition, which we could superimpose on whatever condition it is that we're looking at. And then underneath it has 3 interrelated boxes that look at, from a health condition, body functions and structures, but then it looks at activities and participation. So ultimately what we are getting at is looking at what are the barriers for children and youth to be able to fully engage in activities that are meaningful to them, and life roles and participation in society. And then below that, and I as a clinician, I also look at this as a means of holistic assessment, and teach my clinical trainees this as well. So underneath is looking at the role of environmental and personal factors. And I think it's a really beautiful way to map out scenarios. And I offer it as a way of assessment, but also a way of thinking. And then again, at a broader picture, what might the role of WHO be in moving forward with policy?
It's really nice to meet you. And I've got the image up on my screen, so thank you. That's useful for me to see. And I can share it. Yeah, let me open it up. So let me see if I've got this. Is that sharing the right? Are you seeing what you need to be seeing here? Yeah. Sorry. I think I'm really interested in understanding this more. I don't know this framing, but I want to really affirm that here's this thing that exists already that clearly there's huge agreement around it. So it's a model that you've already got agreement, so you've got the hooks already to be using in any argument, and obviously you are. So I think that's really interesting, and I'd love to hear more about it.
Discuss more at another time.
Great.
Hi, my name is Ashley, and I just have a quick question for you back to the policy frameworks and the work you've done within that space. I'm curious, as we're going forward in our morning and our planning, if there's a particular policy framework that you're using. And what I'm thinking about is like the advocacy coalition framework, and then applying as we're looking at having to concurrently plan for what's needed for big change in this area. I'm looking at what is likely to move us forward at that national and subnational levels, and how we have to concurrently plan for that. And I'm thinking about just some work that we've was involved in Colorado in the United States, looking at a national policy framework of multiple streams and applying it to a state level, and how important that is, because on the national agenda, at least for us in the United States, that's very important, and also equally important to have those subnational agendas moving forward for more broad change. Thank you.
I actually just want to hear more from you about how that's been done, because I think you'll have ideas about this that you certainly will have ideas and experience about this, and that I don't. So I almost skip over the model you're describing in terms of this. So which means I need to learn more about what you're describing, because I come from a social work and social policy context. So my model, my sort of mental model that I come with to everything is a Bronfenbrenner concentric circles, where we've got individuals, communities, families, and so I apply the sort of enabling contexts of the policy at that wider sphere, whether it's international or national. So I'm always thinking, how are we drawing a straight line from the policies that international to national, through to local policies, to practices, to individuals. So that and I almost have that as my default without even being conscious of it. So I think it's useful that I explicitly say that to this audience, because you may not be all sharing that same mental model. But I think what you are describing resonates with that kind of that sort of approach, which is thinking about all these different levels that need to be addressed. I don't have an answer for you about that. Coming sort of the relationship between, I think, the state and the federal governments are always very interesting in relation to where the power lies, and in what domain and what professional bodies have influence at that federal level. So I'd be interested to do an analysis of where power lies and what the agreements are on that, and begin to think about what change you're looking for and who you'd want to be influencing, almost in a state sort of traditional sort of stakeholder analysis around who's interested in this and who has influence in this, and access of interest and influence, and then be plotting who are those who are really influential but don't have much interest, and I can target them to help inform them so that they increase their interest to be wanting to work with us, to wanting to be developing those policies.
Thank you.
Hi, Jennifer. This is Marta. Hope you can see me.
Hello, Marta.
How are you? Thanks a lot to colleagues for the thoughts, but also for your presentation. It's not a question, it's maybe, a thought to share. Obviously, it's not new to you, Jennifer, and mostly to any of us, but my thought is, especially when we are looking at building, let's call it macro, global policy, right? I mean, I very much agree with what has been said. and in the Justice for Children agenda that you know very well, I think we also need to consider how we prioritize. I mean, sometimes it's so many priorities at the same time. What we have discussed here yesterday is absolutely relevant. It takes us to think a little bit differently. It brings another huge and important topic, but how does it fit with the agenda that is already out there, especially in the framework of the SDGs, and how we can think together on, what comes as a priority, not because the rest is not, but how we prioritize, because my feeling is that sometimes it's a lot. It's a lot. Everything is important, but I would say again, we fail on that prioritization and how to bring.
Hello, how are you?
Sorry.
I'm looking for my coffee mug.
Great.
Here. Yeah, it's a pink one.
Anyway, Jennifer, I hope you hear me correctly.
I do think, Marta, I think you're so right that the agenda can very easily be so fractured that policymakers aren't even knowing who they should be listening to. So fine, yeah, I think that's right.
Hi, Jennifer, it's Stan here. I think I'm on the camera now, but just going back to the some work that we're doing, it'd be nice to keep in touch with you on looking at developing a framework for interventions, taking into account the cost of the intervention, the timeliness of the intervention, and then the quality adjusted and disability adjusted life years that we might expect to see. So kind of linked to James's point about looking at this perhaps quite tightly but more holistically as well. So we're working with University of Oxford to develop that kind of model, financial model, to say actually an intervention at this time, this type of intervention with this evidence base, we would expect to see these results from them, and then you can make both financial and kind of moral judgments on how much you want to spend, when you want to spend it, and then you can look to predict the quality adjusted and disability adjusted life years. So back to the point you made earlier about financial, the value generation from that, from those interventions. So it's nice to chat through with you at some point offline about how we might want to populate that model and how we might want to validate that model, just as a good means to frame an argument in different ways.
That sounds really interesting, Stan. I'd love to hear more about that and stay in touch. Thank you.
Yeah, and just on that point before, that's right, Cedric. So that's Jennifer. Just for your information, Stan heads up a violence reduction unit, which is effectively data-driven to reduce violence in the future by utilising data collected through policing, healthcare, social care, etc. And so we have a collaborative arrangement with a number of universities around how that will then influence the national picture in the UK around how we could reduce violence by attending to the social, economic, neurodisability, mental health needs of populations more effectively earlier. So that's the background point, I guess, Dan, if that's right. Yeah. Good. And I think I'm going to hand back to Cedric. Yeah, thank you.
Jennifer, I had a question, but first I wanted to see if the people online wanted to ask a question as well. So if so, could you please put your camera on?
Yeah, I'm hearing it. Okay. Sorry. Can you talk? Sorry.
I can hear you. But if you have a question for us, you can put the sound. But in the meantime, if
the cost about
we're going to find a way to cut this out.
Flights are very difficult, very expensive. Yeah,
So,
he's looking at all
Jennifer,
options.
my
I was
question was,
thinking.
if you can hear me, my question was perhaps to be a little bit concrete, because we have a working session just after, and we've been working for the last 2 days on how to create links between and bridges between our two domain of activities. Now, the child rights perspective, the brain science perspective, and basically how to create knowledge for policymakers and for professionals as well. So I was wondering, Angela, if you, Jennifer, if you can tell us perhaps two things, something very practical based on the example of the work we've been doing on digital justice. I found very interesting the way we can structure the message. And the last example that we did, and you mainly did, on the policy brief, I found that was very interesting to perhaps how to address to policymaker in a different way, to raise concern, to raise needs, etc. And the other thing was perhaps directly to think about the step forward. Do you think at the moment, from the agenda for action and all the work is done from the working group, etc., that the topics that we are dealing with during those 2 days, which is brain science applied to child justice and the consequences and the recognition of neurodisabilities in child justice, do you think that this topic and this interest fit of the international agenda and the call for action on justice with children? Only that as question.
In 1 minute or less. Thank you, Celine. On the policy brief, yes, we've had fun with that in the last 2 weeks, which is always tricky, these worlds of getting agreement, right? This is trying to find agreement between many powerful, influential policy bodies to agree on text on a policy brief. I think for an effective policy brief, we keep in mind that policymakers are so busy. Someone said earlier, there are many agendas that they're having to decide between and wrestle with. So I think we're trying to create messages for policymakers where it's very punchy, it's very short, which is hard when it's nuanced. And so because sometimes it's, and policymakers don't necessarily want to be told exactly what the answer is, because they'll immediately reject that as being the answer if that's not what they agree to be the answer. So we are raising questions in our policy briefs to prompt policymakers to think about things, to prompt, have they considered this angle? Have they considered this? What about this part? So we're not telling them they must do this. The must and the shoulds sometimes don't fly so well with some policymakers. So I think that's one aspect of it. But Cédric, you can speak more about what that policy brief is maybe in the next session. So I hope I've answered that. I hope I've spoken to that. And then the other is, so the Justice for Children and the agenda that you're working on, I mean, are completely, yours is a micro part of that wider Justice for Children agenda. So yes, I think it's absolutely connected. And the 4 strategic levers that we are framing all of our work under, I suspect all 4 of those fit the work that you've been talking about in the last 2 days as being applicable. So the 4 strategic levers I can share with you online, but Cédric, if you find the agenda for action for colleagues, it'll be there as well. These 4 strategic levers are taken from the wider Justice for All agenda. So a bit like we heard from Catherine, the WHO model, finding a model that sits above just children is a helpful one to have the hooks. The 4 strategic levers are new partnerships, in which case for children, we're talking about intergenerational partnerships to ensure voice is a part of, and influence are a part of that. So intergenerational partnerships, smarter financing, evidence and data, and innovations, justice innovations. But in this case, we've been working, Cédric and I, on the digital justice innovations and some of our cautions that we have about how it's being uncritically embraced in justice for children. So yes, I think all 4 of those strategic levers, we could even create something that thinks about the circumstances of those that you're concerned about specifically here across those 4 strategic levers, perhaps, but there's always a space for us to be thinking together further about that if you'd like to.
Excellent. Thank you, Jennifer. Thanks for that. We don't want to keep you all morning, but clearly you should have come to Geneva. So a little bit guilty if we took too much of your time. But thank you very much for being here this morning early for you. And it would have been a pleasure to have you with us. But we are already thinking after 2 days of dinners and drinks as well, that we might do this meeting group group again, perhaps next year. So we will be sure that we'll show the date that you can attend with us. Thank you very much. We'll release you. Catherine, you wanted to ask something? No, okay. We'll release you, Jennifer. And then for the rest of the group, we're going to cut now for a little coffee break. And then from that, we will go to the next session. So thank you very much.
Thank you.